For this exercise, you're gonna need 2 dumbbells that are pretty heavy so that they can keep your feet stable. The key with this exercise is making sure that the dumbbells are in the right spot. A lot of people will put them too close and then they feel like they can't get the leverage they need. The further away, the more often you're going to load your hip flexors a little bit more. Now, this exercise, there are 2 levels, I'll show you both, but the key with this exercise is learning how to posteriorly pelvic tilt. So what you're trying to think of is like tucking your tail between your legs and rounding your back, really crunching here so that as you're coming down, you're controlling it and we're not just moving into extension and arching your back. As you get the control and the hang of this and build strength, eventually you can push past where you have control and slowly fail out of it. So here's level 1. You're gonna start on the edge of the bench, not all the way down, but right on the edge. Your feet are gonna push up into the dumbbells. You're gonna round your back, and then we're gonna slowly lean back where you're trying to control the movement. You're gonna hit a point where you feel like you can't go anymore, and if you do, you will arch your back, and that's where you stop and come back up. When you come back up, we want to control the movement, keeping the connection here. You might shake a little bit. You should feel your abs working really hard. That's fine. Then, once you get the hang of that and you can do it and your body tolerates it for some time, then we can move to level 2, which is actually failing out of it. So you're pushing up into the dumbbells, you're coming down, you're feeling your pelvis lose the position, and you're gonna fail out of it, trying to actively tuck your pelvis, but falling into extension on the bench and then coming back up. So part 1 would be how we start. Level 1 is how we start. Once you get the hang of it, we can move into level 2, and level 3 would be even harder in a different position on the bench. So you can go into even more range of motion, but that is going to be a very different look for the exercise. So these are going to be the first 2 that most people will be able to start with. The key here is having enough abdominal strength to control the load. If you cannot do this without pain, and you cannot do it and feel what you need to, and you just feel a lot of low back discomfort, it is too progressed for you. You are going to need a different exercise. Over time though, you should feel that you can shake a little bit less, get more control, get a little bit lower before you lose control, and really feel a lot more strength in both your core and feel like your hip flexors are lengthening and tolerating more of a lengthened position as well.